The reasons that I really, really love it, enjoy working out in primary care is because you really get to influence patient care right at the very, very start of their journey. So when they've only just started to have back pain or they've only just started to have knee pain, you can get in there really, really quickly and really make a big difference to people's lives, because, you know, knee pain, back pain, shoulder pain can go on for a long time and can really impact people's lives. So if we can help them at the very, very start, give them a little bit of basic advice, it really means that they can get back to their life as quickly as possible. So it's really, really rewarding place to work. It also means, though, that if people do have long-term back pain or long-term knee pain, it means they can pop in and see you. If they've got a little bit of a flare-up, they can see you quite quickly. You're really accessible. You're really part of the community that you work in. You know, they can pop in a couple of times a year to say that, oh, this has gotten a little bit worse, or maybe I've started this new activity and it's gotten a little bit harder to do. And so you just give them a little bit of advice there and then, and it's really accessible. You don't have to sit and wait on waiting lists. You don't have to pay privately. So it's really, really helpful and rewarding to be able to work with people in that way out in primary care. In order to become a physiotherapist in primary care, you initially have to do a physiotherapy degree, and then you tend to start with doing rotations within the hospital setting. This is really, really important because it helps you get a really good basis and background of lots of different health conditions and different scenarios that patients are in the hospital. And you're really well supervised by other more senior physios to learn and to train. And then when you get a little bit more experience, you then can move out into primary care, where you're working very much like you would be when you go to see your GP. You're working in kind of a GP clinic room in a GP surgery. So although you're working kind of with the patient on their own or individually, then you've got that wider team around you. So if you need any help with anything, you would just maybe go knock on the GP's door, and, you know, you might need a medication or something like that. And you also, you know, if there's a patient who comes in that's a bit more complicated, you can all work as a team and chat to each other. You know, sometimes people come in with back pain and we might start talking about their waterworks, and it comes up that maybe they've got a bit of a water infection. We can just pop into the nurse, and we all just work as a really great team within primary care. But getting that basis within the hospital to kind of learn about these other medical conditions that, you know, potentially might pop up when you're seeing somebody out in primary care is really, really helpful. So that tends to be the start of the career path and the career journey. So a typical day when you're working as a physio within primary care involves kind of coming in, having a quick chat to the receptionists and admin staff, kind of see what GPs and nurses are in, have a bit of a chat in the kitchen, have a cup of tea, and then you go on into your room, set up the computers, kind of log into all the different systems, clinical systems, and then you start your day. So you tend to have morning and afternoon sessions made up of different patients who come in with different problems, bone or joint or muscle problems. So you come in, you see them, assess them, have a chat with them, see what the problem is, give them a treatment plan. For a majority of people, it's just that they need a little bit of advice, a few exercises, and then they're happy to crack on, because you see them really, really early in their journey. For other people, then it might be that you have a chat with them about they might need a referral into secondary care, to the hospital for kind of a bigger course of physio, or they might need a referral down to like the local leisure centre, or they might need a referral through to some other support services, whether mental health services or dietetics or podiatry or other community services. So we would do that, and at the end of each session you would just kind of, you have a bit of admin time then to kind of fill in your referrals and your paperwork, your notes. It might be that you need to have a quick chat with a doctor or a nurse about something else that's going on, and then finish up all your paperwork, have your lunch, and then same in the afternoon, and then finish up at the end of the day as well. So if you're considering a career in physio, I'd have a chat with your career guidance counsellors to see what the entry requirements for the university degrees are. Typically it's some science, biology, sport, exercise science. But yeah, I think it's, if you're looking for a job that's not just sat in front of a computer, not just sat in an office, has that flexibility of being out and about, meeting people, chatting to people, you know, having a nice social scene, so like linked with work. Typically people in healthcare are really friendly. So yeah, it's just a really, really nice place to work, to build a nice friendly team where you're interacting with people and you're chatting and really helping the communities that you work within.